All right, welcome back. We were talking earlier, and you said that here you are, a company based in Latham, but you've got 150 affiliated clinics in 30 countries. How does a company go from Latham to all over New York, the country, and the world with a small company with a product like this?
Well, it was interesting. We actually, our first affiliated clinic was in London. A hair loss clinic in London actually saw our website and they said, gee, you guys are actually like telling us, you're not just saying, hey, come buy this, you're actually saying how and why this works and explaining this. And we started working with them and we got to the point where we actually do kind of like a franchise all over the world. So as I was mentioning before, celebrity stylists, we actually just started working with Tony and Guy, and Tony and Guy has 468 clinics, or excuse me, salons in England. So we've kind of started working with them, and we actually set up kind of a franchise. We teach the doctors or sometimes entrepreneurs how to run a hair loss clinic. So we actually have them from all over the world. We actually work with somebody in Egypt. I was in Egypt just before everything happened in Egypt last year. Matter of fact, our doctor we work with there was actually shot as part of that. He was helping in the protests. So we've kind of grown, and part of it is the lasers. We actually produce the lasers now, so that they come and they want a laser, and then once they find the laser, they see that really they want to learn the proper treatment techniques and that there's new innovations in the products and the lasers. So we actually show these doctors how they can treat themselves. So they go into, whether it's Australia or it's New England, we have places in Boston, or England we're very big in England right now. So we actually train them on the latest techniques. So it's interesting, even in Kuwait. So it was interesting going to Kuwait and sitting down with the doctors there and teaching them and showing them how to run hair loss there and integrating it into their culture. And different ethnic people have different needs too. So that's part of what's fun about going to different parts of the world and helping them as well.
Now, have you found, I guess when we talk about, hair loss and hair regrowth, I guess we sort of think about typical male pattern baldness, or you say that a lot of women with thinning hair. But there are other things that may cause hair loss. Do you have better success with any of those things?
Well, we try to take a whole approach, but there are things like alopecia areata, which is spotty hair loss, and they really don't know exactly what caused it. And we have about a 50% success rate, where we have a high 90% with normal male or female. We have about a 50%, but for most people that have already treated it, to get some help that way is very good. Things like thyroid, anemia, there's a tremendous amount of different things that cause it. Drugs, that's one of the big things that people don't know. When you go and take a pill from the doctor and you read, this may kill me, it may ruin my liver, that's what you think about, but you don't read down to the bottom, well, it may cause hair loss. A lot of common drugs cause hair loss. Lack of protein can cause hair loss. So that's one of the things when we work with a whole person, we try to look at things as simple as how much protein are they eating, what drugs are they taking, what's their family history. Everything, because you really want to look at the person as an individual, and that's the key to giving them the best results, is looking at their particular situation.
So it's really a holistic thing. It's not just looking at and saying, okay, we can give you this and it'll come back. You're sort of looking at what is required of the whole body to make it happen.
Absolutely. That's where some of the one of the tablets that we have is all the hair nutrition that you need, the things that your body needs, because your body's smart. It knows if you don't have stuff, I'm going to give it to the eyes and I'm going to give it to the heart, not to the hair. That's why when you go on crash diets or you have tremendous stress, people lose hair. Those are two big ones. Crash diets, stress, chemicals can be that, all the things that people put on their hair. So when they go to a salon, they want to be going to a salon that's using good quality products for them, or buy those at home. Some of the shampoos are very harsh. The average shampoo has things like sodium lauryl sulfate, cocamide DA. Well, those are engine degreasers. They were originally designed to degrease engines. They're great at stripping away dirt and oil, but they've been shown in clinical studies to actually irritate your hair follicle for up to 7 days. So, for example, ones that we would give you wouldn't have that. So there's a lot of different things. We take a look at everything.
And so we don't have a lot of time left, but I mean, are you surprised? I mean, you said you sort of went into this, you didn't know what was going on. You say you have sort of skeptics. Are you surprised at how successful it has been, how successful you've been in making this happen?
I am. And it's interesting because when we brought in the first lasers, they were somewhat successful. Some people use them. Now almost everybody's using the laser. So the amount of change in technology in the laser has been phenomenal. So, and even like our natural growth product, the people that just use that, they want to stay on that. So yeah, I've been amazed at the success. And when you get people that come in, last Saturday I was in and talking to someone and said hello and introduced them because I'm kind of behind the scenes, and they were amazed at how much success that they had had.
All right, William Blatter from the Hair Loss Control Clinic. Thanks for being here. We hope you learned some more information about hair loss and hair regrowth. You can get more information on our website, fox23news.com. Thanks for being with us. We'll see you next week.